working at the grassroots level, implementation, technical and policy level advisory, as well as she has also experience of planning and managing high-level projects and programs. She is a water quality champion and joining back as a trainer to share her knowledge. The second session will be the fieldwork detection of some waterborne diseases. Rashika will lead the session. She is a graduate from Ajimtem University, Bangalore, and she has been part of the development sector for roughly 2 years. She is part of INREM since last September, and she has completed a water quality management course and completed a trainer certification course. She is joining us as a trainer today for the second subsession. The third subsession is on integrated water and health management. Shishon Roy, basically he will be joining to facilitate the third session. He's a water quality champion from batch 5th. Recently, he worked for UNICEF Bihar as a district wash nutrition consultant. She is currently undertaking independent consultancy for project proposal and organizational development on wash, nutrition, and sustainable livelihood. He has completed a trainer certification program and coming back to this forum to share knowledge. So I welcome all the three participants here. Okay, okay. Sorry, I missed the chat. My voice is not clear. So I will just welcome all the participants here and the three trainers. The first trainer is Nabanita Rudraji. Welcome, Nabanita ji. Can you just confirm my voice check here if it is clear now?
Yeah, it is clear.
Thank you. Thank you. So Nabanita Rudraji, she is covering the first topic, that is introduction to water-related health problems. The second subsession, that is fieldwork detection of waterborne diseases, will be covered by Rashika. And the third subsession on integrated water and health management will be covered by Shishon Raj. So I request Nabanita ji to start the first session and requesting technical team to share the screen.
Yeah, thank you. Thank you so much. In fact, yeah, well, by the time the screen is shared, I like to introduce, talk about what and from where I am coming, right? So I am basically a public health professional. Have been working in this sector. I would say water quality practitioner. So I have faced problems, right? I have faced problems when I was in village working with community. So and then understood the relation between health and water, and I really, in fact, like to congratulate the team, which is doing this kind of training for everybody. So let us together begin the journey to understand introduction to the water-related health problem. So what is water? Jal hi Jeevan hai, which is started with this kind of dialogue today. So water is important, water is essential. Without water, we cannot think of life, right? So absolutely, it has to do with something which is related to our health. Now, how do you think that water is helping? The quality of water is helping us. Which part of the body do you think? Internal organ or external organ, or what all can be affected by waterborne diseases? Next slide, please. So, our is the entire body which is getting affected when we are, in fact, drinking or consuming in fact, water or contaminated water, which we call, or it is only affecting our some parts of our body. So let us go to that journey to find out which part of the body is affected when we are consuming contaminated water. Next slide, please. So you can see very nicely, in fact, the skeleton as the body is created, and you can see each part. You name a part, name an organ, and you will find it is affected by one or other water contaminations, be it chemical, be it any other, be it bacteriological contamination. So if the water has more boron, it can affect our nervous system. Fluoride causes a discoloration of our and damage of our teeth. Mercury affects the brain again. Chloride, you name lead, nitrate, which causes blue baby syndrome, very serious for infants. Pesticides in agriculture, used in agriculture, if mixed with our drinking water, can cause damage to nervous systems and also the reproductive system. So you name a contamination and you will find this contamination is doing something differently, acting differently with our body and causing a lot of problem. We have, I am sure in second session, you must have heard about arsenic, what it does, cadmium, what it does with our bones, arsenic, which causes skin cancer and skin diseases as well, fluoride, how it impacts our bones. So iron, how it works when it goes to our stomach. So there are many, in fact, chemicals, or we will say elements. If it goes in our water and we are drinking that kind of contaminated water, it creates complex problems in our body. So how do we do and how do we identify? Because when we are at the community level, we generally do not know. If we do not know which element is doing what, then it will be very difficult for us to find out the problems. Next slide, please. So we tried to identify, in fact, 20 critical water-related diseases, and these are segregated in 4 parts. First is groundwater-related diseases. So when chemical contamination goes into our groundwater, what kind of diseases it can create. The second one is fecal oral route, which is actually contamination of water after it is drawn. It may be safe when we are withdrawing water from ground, but when if we are not using or not keeping that water properly, it can go contaminated again. And this fecal oral route can cause many types of diseases. There could be some diseases because of the contacts with infected water, like mosquito breeding, which is direct contact with water. So it is a related disease, we can say. And there are few other diseases which are also being in fact, contacted by contaminated water. These are the underlying factors. Contaminated water is an underlying factor for this kind of diseases. So if we can divide, if these are divided into 4 parts, you can see the various parts of our body are being affected, and various elements like we can have fluorosis, we can have alkanosis, we can have methaglobin alkanosis, because our hemoglobin will not be able to carry that kind of, in fact, oxygen to the blood, and then we will face suffocation, we may face headache, and these are few diseases, right? If water is not kept, not maintained properly, then we can have typhoid, diarrhea, hepatitis, cholera, so on and so forth. And you can also see that cyanobacteria is also, if we are impacted with that, and that can create another type of diarrhea. Next slide, please. So few waterborne and vector-borne diseases are in fact shown in this picture. Disease we got from consuming contaminated water is called waterborne diseases, and diseases we can get from mosquitoes breeding on stagnant water is called vector-borne disease. Why there is a difference? Can anybody answer this question? You can use the chat box to respond. Can somebody answer why there is a difference? What is the difference between waterborne diseases and vector-borne diseases when they are? Yeah. So waterborne diseases are direct, it is causing disease directly, and vector-borne diseases are some other organism is in between. So there could be mosquitoes and other, in fact, maybe some animals which can create this disease. So that's the difference between waterborne and vector-borne disease. How many people in India are affected by different waterborne diseases? Can you name? Can you come up with some answers? Next slide, please. How many people in India are affected by different waterborne diseases? Can I get some answers from you? It's about 700 million. Yeah, it's about 700 million, and 70% of diseases are waterborne diseases. That's correct. That's correct. Next slide, please. So now we are studying some problems. How much disease burdens we have because of water quality problems in India. Salinity, if you see in India, we have 137 districts which are which have salinity is a problem. It could be geogenic. Geogenic means natural. It could be natural or it could be man-made. In coastal areas, we have soil water, saline water ingression. That's the man-made cause of it. Because of salinity, we may have kidney stones due to proper hydration in some areas. And it is, if you see how much it costs to a family, it's about rupees 7,500 per family per year. Now, coming to fluoride, we have 203 districts in India with fluoride problem. And again, about 5,000 rupees per capita annual expense goes to fluoride. If we see arsenic, 35 districts in India has a problem of arsenic. Assam, Bihar, West Bengal are the major having the major districts which have arsenic. We can get disease named archinosis. Daily, 5 to 25% of the population we can find the Delhi rates. So disability, Delhi is disability adjusted life. It's 5 to 27 per thousand population. Iron, if you see iron, 206 districts in India has iron problem. Mostly geogenic. Iron is mostly geogenic. It's because of iron overload and suspected diarrhea and linkages. It happens. Biological diseases are, there is no, in fact, estimates available. This is because of poor sanitation and poor hygiene practices, and this increases the load of malnutrition. The diarrheal problem, it is also because of this biological contamination. The Delhi is very high, and about 4 lakh 50,000 deaths happens because of malnutrition. If we talk about agrochemicals, now we all know that in agriculture, various pesticides and fertilizers are used. And there is actually no estimates available because it is rampant. It's happened everywhere. And it has multiple impacts, which actually we need a pan-India study and also rigorous study to measure that. Apart from these, all these, in fact, inequality problems, we also have industrial effluents, and there is also no estimates available for them. Multiple impacts because of industrial effluents happens. Next slide, please. So now we need to see the geogenic constituents of in groundwater. There are few things which are at the major level. There are few things at the secondary, or there are few things at stress level also. Like sodium, calcium, and magnesium, if they are available in major level, they start impacting our body. There are few things which are secondary, like potassium and iron. There are few contaminants like aluminum, arsenic, cadmium. If they are available in trace, even in trace 0.0001 to 0.1 mg per liter, still they start impacting our body. And there are other which are even further available in stress. If they are available in stress as well, they impact our body, and they all of them are toxic to human health. So you can see how important is to measure water quality, how important is to measure, to know what type of water we are drinking, what is the constituents available in our water, and by drinking this kind of water, what kind of problem we are going to get. Next slide, please. So there's the slide which says that 150 million is the conservative estimate of number of people affected with water related diseases in India. And this number is even very high. And almost maximum, I would say it's 1/3 of it because of chemical contamination. Diarrhea is around 15%, and 38% is dengue, malaria, and others. So that's the another part of it. So this is the estimate being given by Central Bureau of Health Intelligence report in 2019. So you can see if we can save, or we can safely handle our water after extraction, also before extraction, we can safely handle our water, how many number of or types of diseases we can avoid. Next slide, please. So this is all about water quality, and we will be going to the next second session. But before we go to the second session, we'd like to understand, what do you have any questions which you want to respond? You want response for? Yeah. I could see some question on Metha. Yeah. Okay. Yeah, I could see some response on blue baby syndrome, the source of these tables and citation. Source of these tables and citation is government data, and BIS is the institute which works. So we would have taken it from that data. Methaglobinia is a problem which happens because of fluoride uh, uh, flo- uh, availability of fluoride in our water. No, yeah. And then blue baby syndrome, it is actually, if you see methaglobamia and blue baby syndrome is because of nitrate. So maximum, in fact, in many cases, we have seen that it is because of agrochemicals. The nitrogen which is utilized in agriculture field, if it mixed with water, and then it creates these two diseases: blue baby syndrome in newborn and methaglobamia in adult also. Any other questions you have? Thank you, Kiran. You can take it.
Hello, Navitha I
Yeah,
think you are done with the slide presentation.
yeah, that's right. You can take it.
Okay. No, there is another part. Right? A few other slides are there.
Is it? I think water quality. How does water quality affects newborn child? Yeah,
Yeah. So,
yeah.
screen
Okay,
presentation, technical team, can I request you to continue with the
yeah.
presentation? Can I change the
Okay,
next slide?
okay. So, how does the water quality affects the newborn child? Okay. So, water quality and its impact on newborn child. We are trying to study that. So, when we see that newborn child, that there are problems with newborn child when the water quality is not intact, right? In onset of pregnancy, if mother has problem with iron deficiency, that's the impact of water. When pregnancy progresses, if the mother has calcium deficiency, that's again the impact of water. While delivery, if the maternal fetal transfer, there is a problem with water quality. Diarrhea and calcium from feeding also is not absorbed. Calcium is not absorbed because of diarrhea. When if mother is having once or twice diarrhea during her pregnancy, then it's the mother becomes leaking pot. Whatever she is nutritious food she is consuming, it is not going to the baby. So baby may have cognitive problems. So when the baby is born, he or she may be less weight, low weight baby. The baby can grow to a young child. If the water is not clear or not safe, then baby's brain development and growth may be affected. Next slide, please. Nutrient deficiency can cause some water contamination problem. Some contamination can be because of a cross placenta barrier to enter the fetus, and some problems causes infection and can be threatened to the both life of mother and child. So if this kind of problems happens when mother is pregnant and also the baby is small, there can be cognitive deficiencies. There could be also some physical problems which can threaten both mother's and child's life. Are all the water diseases affecting us for the same time duration? Do you think that all of them are affecting? Next slide, please. For the same time or same duration? Are they affecting for the same time or same duration? That's answer to which is no. Some of them are short term, some of them are long term. Can we go to the next slide? Short term contamination are mostly seasonal. They are likely to be pathogenic. They could be part of fecal oral contamination route, could be cholera, could be diarrhea, could be anything else. The long term could be building cumulatively. Mostly chemical contaminations comes to this part, small doses daily or above the limit. Fluoride could be one of it. Next slide, please. So if we can see the visible and invisible form of waterborne diseases, few could be visible. Like if we have fluorosis, teeth can be seen. You can find stains over your teeth and over the teeth of patients who are drinking water with more fluoride beyond the permissible limit. And there could be invisible. We can see anemia, which linked to multiple type of contamination. It's not related to one; it is related to multiple type of contamination. Mostly they are that in fact comes or surfaced after later stage, but not always. Next slide, please. Few things are directly related and a few are multiple causal waterborne diseases. Direct linkage will be arsenosis. So easier to detect. You will uh, find lessons over the hand. It's a more social taboo and myth associated with this kind of diseases. But actually, water supply. If the water supply is not good, it affects this kind of a problem. There could be multiple causes like arsenic, not only causes a cause of, in fact, this kind of lessons, but it also causes gallbladder cancer. Water supply leads to this kind of partial issues and partial results. Next, next slide, please. So in summary, water quality is an impact to most human health. We have seen that water quality is important. If the quality of water is not being taken, then we are ending to or leading to many types of diseases. Some of them can be fatal also. In India, we must be careful to how water quality affects newborn and their future. We have seen our malnutrition rates, our in fact child mortality rates, which are very high, and we should take care of it. There are could be chronic causes. Few are short terms, few are visible. They are multiple, but versus there could be single cause. And this is the way which we can look at these diseases. This is all from my side. If you have any questions, I would be happy to respond.
Thank you so much, Navanita ji, for this detailed, presentation. And it appears that how we have well managed to communicate the problem of water quality and in terms of identification of the health impacts on the health. So it was so much detailed, and I think there are a lot of questions here in the chat box also. We'll try to come
Yeah.
to all the questions, in future, and basically we are also recording the session, so we'll have your questions. So we'll let you know with the answers in coming days. Also, you can write your queries in the chat box in the WhatsApp group, and we'll try to respond to all the questions of it. It is very important for us.
So I just would like to answer one question. Is there any existing network bonding all doctors in India, any states which collects data for doctors? I assume that you are asking for a network which collects this kind of data and does analysis with the Department of Drinking Water, right? So this is IMA, Indian Medical Association, supposed to be working on this line. Indian Medical Association is supposed to be working on these lines, and this is actually one part of their work as well. They are working, and in fact, directly with our government, with Ministry of Drinking Water and Sanitation, to work on these issues. Yeah.
Thank you so much, Namita ji again. And I think there is a close relation between health and water, and basically it is impacting on the children mainly. And there are few cases that you can easily detect in terms of what affected by fluoride, arsenic. So you can easily detect. So we'll in today's session we'll go in detail about all these things, and this is first part which Navanita ji has shared with us. Now, in the uh, as a as a next step for this session, we have assessment for you, and the link is already shared in the chat box. You can kindly click the chat link provided in the chat box and complete the assessment. The assessment is very important for. Okay. Thank you, Lopamutra ji. You have scored well, 4 out of 4. You can also write your favorite question here in the chat box. That what is your favorite question for this assessment? Once you are done with the assessment, you can let us know in the chat box also that we have completed the assessment. So we'll wait for participants to complete the assessment, and then we will move for the next part. We'll wait for 80 responses here from all the groups in the English breakout room and Hindi breakout room. So participants from all the room will complete the assessment and we'll move to the next part. Till now, we have received 13 responses. People are also participating in the assessment from the Hindi group also. Thank you, Mr. Lakshmi ji. Thank you, Lavamita ji. Question number one is okay. We like the question number one for this assessment. Thank you, Hitesh. Thank you. So average score is really high here. It's 3.05 out of 4, and we have received more than 20 responses. We'll wait for 80 response, then we'll move to the next part. Okay, Vijay Lakshmi ji feels that all the questions are she likes. So thank you so much. We hope that people are liking this part of assessment and they can think, they can connect about immediately after the session. So it is very helpful. Thank you, Dr. Hitesh. Okay, most of the participants have replied in the chat box have received really good marks. 4 out of 4, 3 out of all the marks are really good here. So we have received 40 responses. That is 50% of our target today. That will wait for 80 responses. Then we'll move to the next part. Congratulations, Shikanta ji. Congratulations, Dr. Pravina ji. So I request all the participants here in the chat box. Can you please submit the assessment here and then we'll move to the next part. We'll wait for it to response. Thank you for being active. All the participants here are really active and participative in the chat box. So I think this is what encourages us to engage more and bringing more knowledge and person water quality champions here. So thank you so much. In the next part, we have Rashika here. Will be basically leading the second session. So she will be.
Yes, Tanvi, hi.
So this Rashika will be leading the field-based communication part, and she will basically she will lead as a facilitator for the second part, and then for the third section, that is integrated water and health management, Sushona will be presenting. So we'll wait for some time and then we'll move to the next part. And I request Rashika to get ready and you can check the screen share here. Then we'll start for some time, in some time. Thank you, Sushonji. We can see you are here.
Good afternoon.
Good afternoon. So we'll wait for some time. We'll start with the second session here. Rashika will be leading and then we'll complete the assessment for the second part. And then Sushonji will be leading the third section today.
Is my screen visible, Navneet? Hello, am I audible? And is my screen visible?
We cannot see your screen. So you can just reconnect again with the screen share and then we'll.
Okay, I'll do that. Okay,
So,
it seems like there's an issue with my screen share. Can the tech team share the screen?
So, Rashika, you can stop the screen share and so that technically you can share the screen.
Yeah, that's what. So my laptop's stuck, so I'm not able to stop the screen share. Just a second, I'll just do something about it.
स्क्रीन शेयर हो गया है, दिख रहा है स्क्रीन?
Okay, so the screen share is completed. Not able to see. Okay, so we'll wait. I will wait. Rashida, can you just disconnect and rejoin again?
Yes, I am here, uh, but I would need the tech team to share the screen.
Technical team can share the screen now. I have stopped the participant share. वैसे भी आवाज आ रही है आपको?
हाँ नॉलेज जी बोलिए।
आप अभी स्क्रीन शेयर कर दीजिए। मैंने राशिका का स्क्रीन शेयर स्टॉप कर दिया।
ओके
Rashika, if you're getting the voice.
Yeah, I'm also able to see the screen. I'm sorry about this. Um, so I'll just start with the second subsession. Good afternoon to everyone. And this subsession is on um, how to detect waterborne diseases in the field. So Navanita ji just, established that link between water and water contamination and diseases that can possibly take place because of water contamination. So in this session, we'll see how to detect these diseases on the field. Next slide, Vaitek. So there's a question for you. What are the most visual forms of, diseases that are caused due to water contamination? Like visually, what are these diseases that you can see? Uh, the effect of water contamination, the effect of these contaminants on human body. What are these diseases? I see fluorosis, diarrhea, fluorosis again, typhoid. Yeah, there are a couple of contaminants that have a very visible effect on the human body. Diarrhea, fluorosis, all of these are few of those diseases. Next slide. And as you correctly pointed out, fluorosis is a very visual sort of a disease that happens due to fluoride contamination in water, and then it is caused due to consumption of high fluoride in water, and consuming this water over a long period of time causes fluorosis. So excess intake of fluoride through either food or drinking water and a lot of industrial pollution has also caused increased fluoride contamination. So as you can see in the picture, there is this child who has a bow sort of a shape to his leg. It has an increased curvature. That is because of fluoride. That is because of excessive fluoride being consumed. And then there is dental fluorosis, skeletal fluorosis, and non-skeletal fluorosis. These three are the types of fluorosis caused due to fluoride contamination, caused due to high fluoride in water. Next slide. So the first type of fluorosis that we'll talk about is dental fluorosis. And as you can see in the picture, the first picture shows the state where there is no dental fluorosis, and the last picture you would see that the teeth are all yellow and there are visible lines on the teeth. So that's a severe case of dental fluorosis. And then it happens mostly to children who are uh, just getting their permanent teeth. So after the age of 6, between the age of 6, exactly, Dr. Hitesh, as you mentioned, mottling of teeth. So this is for this is usually found in children between the ages of uh, 6 to 12, where their permanent teeth is just starting to get permanent teeth and their enamel is just getting formed. And so to easily detect this in the field somewhere, you can, go to school and see if children between the age of 6 to 12, if they have such lines on their teeth. So it is an indication that the water there might be contaminated with fluoride. There is high fluoride content in that water. And then usually to differentiate between other staining of teeth, which might be caused due to maybe tobacco consumption, a simple way to do that is to see where these lines are. If it's closer to the gum, then it's because of tobacco consumption. If it's farther away from the gum and the lines are horizontal in nature, so that is because of fluoride in water. Next slide. Skeletal fluorosis. So you can see the pictures here. The curvature of the leg of in all these pictures. In three of these pictures is not normal. There's either a bow leg, or it's inverted inwards, and then you can also see that it affects the spine. But then these are severe cases of skeletal fluorosis. Before it escalates to this level, there people often complain of joint pains or stiffness in their joints, and difficulty in movement, experiencing pain in their joints when they move. So these are the preliminary sort of indications of skeletal fluorosis. So these are something that you should take care of when you're in the field. And this is again, as mentioned before, it is caused due to high fluoride intake through food and water. And then one major difference between uh, skeletal fluorosis and then other bone deformities. So for example, polio and skeletal fluorosis, if we compare the two of these, skeletal fluorosis is very gradual. So it begins from joint pains, it begins from stiffness, and then for it to get to this level, it takes a little bit of time. So it can be caught early also. Whereas something like polio affects the nerves and it may lead to paralysis. So that's the difference between between two such deformities. Next slide. And then how do we detect, early detection of skeletal fluorosis? Um, these are a few exercises that you can see here. If people are facing difficulty in touching their feet while keeping their knees straight, bending and touching their feet while keeping their knees straight, then that's a sign of, or that there's a possibility that the person has skeletal fluorosis. And then getting people to touch their chin to their neck, or getting people to, as you can see in the third graphic here, um, crossing their hands behind their head, hands with their hands around the neck. If all these exercises are difficult for people, then there's an indication that there might be skeletal fluorosis. It can lead to some sort of a deformity, extreme case of skeletal fluorosis. So this helps in early detection. And next slide. Then apart from dental fluorosis and skeletal fluorosis, there is also non-skeletal fluorosis. And as Mr. Satish in the chat box mentions that, very correctly mentions that, there is gastrointestinal issues due to due to consumption of fluoride contaminated water. A lot of places people feel bloated or they don't feel very hungry, and then there's a lot of other issues associated with intestine and stomach that occurs when fluoride contaminated water is consumed at a longer period of time. And then it also affects the brain development of children. There are neurological manifestations also, affects the fetus, and it often leads to anemia also in women. So it has a lot of uh, effects, and not just visible, it also affects the body. And there are fluorosis linked disorders also, and there's a paper that you can have a look at which very nicely explains all of this, how non-skeletal fluorosis affects people. Next slide. So a question for all of you. You can respond in the chat box. Which is that contaminant that is very commonly found in the endoganglionic plains, and it leads to cancer? Exposure to this contaminant leads to cancer uh, in people. Which is that contaminant? This is mostly found in states like Bihar, Assam, all those states along the river Ganges, along the river Ganga, which is that contaminant. It has a very visible manifestation. Okay, I see a lot of responses. Arsenic, yes, you're absolutely right. It is arsenic. And uh, I see a few other responses also, which is also valid, but arsenic leads to cancer. And next slide. And then we'll talk about arsenicosis that is caused due to exposure to arsenic, and it's a very chronic problem. And it is mainly, as mentioned, it is mainly found in the eastern India, and now recently it is also emerging in Karnataka and Gujarat. So what arsenicosis looks like is that it causes lesions on skin, and it causes melanosis and keratosis on the human skin, on the human body. And it also, in extreme cases, it also leads to lung, bladder, and kidney cancer. Next slide. I just spoke about melanosis and keratosis. So here we can see that how does this look on the human body. It hardens keratin, and melanin hardens because of exposure to arsenic, and this is what it looks like. Next slide. So while we're in the field, how can we confirm cases of arsenic? So the best way is to test water for arsenic and look for what we just saw. We saw melanosis and keratosis, right? So we can look for dark spots. We can look for skin with a lot of cuts. We can look for such lesions uh, uh, on people that are exposed to such water, or where there is suspicion that arsenic might be there in the water. But then there are other ways also. What can be done is that there is you can ask the community there if there are cases of cancer in the people there, and you can also ask people of different ages if there has been, older people have experienced cancer, or are younger people now experiencing like experiencing cancer in particular more now. So that might indicate that the water is contaminated with arsenic. And so such sort of exercises can be done in the field to detect arsenic in water, and to take steps to prevent arsenicosis. Next slide. So now that we've spoken about arsenic and fluoride, there is also diarrhea, as a lot of you mentioned, a problem of, it is a problem caused by contaminated water. So we just see if there are simpler methods to record diarrhea and problems related to it. Next slide. Next slide, Vaji. There are a couple of waterborne diseases which are seasonal. So why do we say that these are seasonal? You'll find that occurrence of these waterborne diseases is mostly around the time of monsoon, where you would see that a lot of water is stagnated somewhere. So such things that uh, lead to bacteria multiplying, or then providing an environment where bacteria is able to multiply, where such contamination is able to affect the human life around it. So waterborne diseases are easily transmitted via contaminated water, and especially where this water is used for domestic purposes or is around stagnant water where vectors can breed over it. um, and then it's also important to note that diarrhea, that there might be multiple reasons of diarrhea. So if you could respond in the chat box, if just water contamination, if it's only caused because of water, or are there any other factors that cause diarrhea? You can respond in the chat box. Next slide. And then apart from this, the risk of, as I mentioned, the risk of waterborne diseases is usually higher in areas. First of all, it is seasonal, but then areas where there is poor quality of the pipelines, water pipelines and sewage pipelines, where there is a possibility that drinking water and sewage might get mixed somewhere, where there are poor sanitary conditions, unhygienic ways are being followed, or there are improper facilities where proper sanitary conditions cannot be maintained. And then open defecation near water sources, waterlogging, and then waterlogging that provides an environment for breeding of mosquitoes. That is also where all these waterborne diseases are found, are mostly found. Next slide. So there are a few surveys, field-based surveys. I saw a response in the chat box where someone mentioned that survey. I think Rijan just mentioned that surveys are a good way of detecting, being able to detect waterborne diseases. So there are a couple of factors that can be kept in mind while doing such a survey, such a field-based survey. So the first is that you can always see the water and sanitation conditions of that area. Is it open? Is it open defecation free? What is the status in that area? Where is this practice being followed? And then apart from that, the drinking water sources can be tested. Drinking water, if there is contamination, and then if there are places that, as we just saw, what are the conditions where vector-borne and waterborne diseases usually flourish. So if those conditions are there, then a survey about where these areas are, how close to the human population, how close to the human habitation, all these areas are, and then these need to be observed. And it's important to see that all these surveys are being done every 3 months, and especially around the time of monsoon, it's very important to undertake such a survey. And collaborating with health workers there, and then doing a survey at family level with families in that community is a good way to do it. Next slide. So which are other related diseases that we can know about? You can respond in the chat box. What are the other waterborne diseases? This is so we'll first see blue baby syndrome and why that is caused. Next slide, Vahiji. So blue baby syndrome is something that is caused due to exposure to nitrate. High nitrate contamination leads to this, and it's usually found in infants. And it restricts blood flow and the flow of oxygen in the blood actually, and causes breathing problem. And it also has a lot of possible carcinogenic impacts on the human health. Next slide. Iron is also a major contaminant that can cause gastrointestinal problems, and then it usually interferes with zinc and manganese absorption in the human body. And a lot of exposure to iron can lead to liver cancer. Next slide. I just saw someone mention Minamata in the chat box. So that is an interesting outbreak, an interesting thing that you can look up. So mercury contamination, mercury is also very toxic to the human health, and it is highly toxic to the extent that it can be absorbed just through inhalation, or just by touching it, it can get absorbed into human body. So it is, and it causes a lot of, it has a lot of implication on the nervous system uh, and overall, overall body actually. So it's highly toxic. Next slide. Uranium is another contaminant, and there are a few hotspots in there's a hotspot in India as well. There's a place called Udyanam where a lot of chronic kidney diseases have been detected, and it has been connected to possible contamination of water with uranium. It's highly harmful to kidney, and uh, but it is important to notice that although it is very harmful, it is not uh, radioactive. So this was it about uranium. And next slide. Manganese is also another contaminant, a possible contaminant that has neurological problems, neurological implications on the human body. And low iron can result in increased manganese absorption, and anemia can also be caused due to manganese contamination. So it's an important it's an important contaminant to take note of. Next slide. So we've reached the end of this subsession, and so first of all, it's important to be able to identify symptoms to actually narrow down on a waterborne disease. And then apart from that, there are a lot of new and emerging diseases because there are a lot of new and emerging contaminants like uranium that was mentioned. And then education on water and health, knowing about what the linkage between water and health, water contamination and health, can help detect health implications at early stages and help prevent the problem from worsening. So this was it from my side. I will now hand it over to Navneet. Thank you.
Thank you so much, Rashida, for bringing so much detail of the specific contamination and how we can identify in terms of its health impact. I request technical team to kindly share the assessment link here and requesting all the participants to complete the assessment. So after completing the assessment, we'll go to the next part. So after learning from the details about the waterborne diseases and about its health impact, now we'll go to the next part of managing the health through managing the health and water through integrated approach. So we'll go in the assessment here because you have already got the link in the chat box. As you can see, 29 responses have been received from the Hindi group of today's session who had completed the session earlier before us. So we'll wait for more response and then we'll go to the next part. So I request all the participant here to complete the assessment. Once you're done with the assessment, can you please update us in the chat box here? You can write it, you have completed this assessment, or you can share your score, and you can also write your favorite question. So as we could see from the chat box that we already know about the detail of arsenic impact, the fluoride impact, and all the other waterborne diseases. Many of us also know about the fluoride, different types of fluorosis, uh, dental fluorosis, skeletal fluorosis, and non-skeletal fluorosis. So we are just sharing our knowledge here, and we are trying to understand the impact of these contaminants, chemical contaminants on health. Thank you, Dishiji, and congratulations. We'll wait for more response. Thank you, Satishi, and congratulations for full score. Thank you, Michelle. For some time, and then we'll move to the next. I hope the score is really high here. All of us have posted everything really well marks. That is 5 out of 5. Thank you, Karkiji, for the update. Thank you, Rajiv Kumar. The average score is really high. That is 4.23. As you can see in the screen, 58 responses we have received. We will wait for more. We'll wait for more response, then we'll move to the next part of today's session. Okay, Narendraji, I will request a technical team to kindly share this. You can also get the assessment link from the chat box in the WhatsApp group, and you can complete the assessment. Now I request Sushanji, can you just confirm screen share? Can you start a screen share? Then we'll move to the next.
Yeah, I'm just doing it. Yeah, is my screen visible?
Yeah, if you can make it full screen, then it would be great. I think in the view option.
Yeah, is it in the presentation mode right now?
Yeah.
Okay, thank you.
We can see. And
So,
over to you,
may I
Shushanji, for
start?
the. Yeah. Can you start?
May I start or shall we wait for a few seconds for the, okay, okay, thank you. So welcoming all the participants, I'm very glad to be with you right now to share some facts on integrated water and health management. So in the earlier session, many of us have learned that how water quality impacts the health, and therefore there is a greater need of integrated management of water and health. So in the just before we go into the detailed presentation, just I want to gain some insights from you people, that what is your opinion on the sole objective of the water supply and other aspects being undermined in the present scenario. Can you just write down in the chat box about your opinion, that what is missing today with water supply being looked at as a sole objective? Can someone write down their opinion, please, in the chat box? So before going into more details, we just want let us learn what is the actual backdrop of integrating water quality with that of health. What is the genesis of a integrated management of water and health together? So it was during 1854. It was when John Snow, an epidemiologist who has established the relation of water quality with that of health aspects, and the health, how it is impacted by the quality of water that we consume. So after that, we find in India that there are departments which are integrated in nature and named as public health and engineering departments. That is the backdrop of but still there is a need to emphasize on integration of water and health management into actual practices, just because in most of the instances we feel that the water supply issue are only been constricted for supplying of water, rather than integrating it with the quality parameters of water that directly affects the human health. In the next slide, we will connect water quality with nutrition and health. We can find in the slide that water quality affects the intake and absorption of nutrients, and this absorption directly is linked with nutritional deficiency and causes various forms of diseases. And where vulnerable section being the malnourished people, particularly women and children, they are the most affected segments of sections due to water quality problems emanating out of malnutrition, nutritional issues. Water quality, the next slide is water quality and nutritional status scenario. That poor nutritional status increases the risk of water-related health problems. Malnourished children are more prone of diarrhea. Deficiency of bone-seeking mineral like calcium, magnesium causes more absorption of fluoride. Less intake of protein and protective antioxidants leads to arsenicosis, and micronutrients interact with toxic metals at several points resulting into malnutrition. So there is a definite link of water quality with the nutritional status also. So if water quality is being hampered, then the nutritional status is also getting worsened. Next, in this slide, we can find that what are the water and nutrition related diseases that are caused due to improper drinking water quality and quantity. In terms of quantity, you will find that if there is a low consumption of water, there will be obvious loss of nutrients. And if there is contaminated water, uh, uh, we have to intake regularly. Then also there will be certain type of diseases. Poor nutritional absorption is leading to malnutrition. So there is a question for you. Can you just think of few water and health related problems which has nutritional linkages? Can people respond in the chat box, please? What are the health to water related problems having nutritional linkages? I'm not getting any response, and the outlay is such that
Maybe there is some issue with the network.
please, I am
Shraddha.
just getting uncomfortable because I am not able to manage the outlay. How the outlay is being, I am not able to move the cursor also.
So we'll try to.
Is there any response on the responding in the chat box? I'm not able.
Yeah. Anemia, diarrhea, urinary infection, rickets.
Right.
A lot of
I'm
response
unable
here.
to interact with the people also, just because I'm all the uh, screen outlets has been stuck.
Shishwanji, you can do one thing. Shishwanji, you can do one thing. You can stop screen share and reshare it back so that you can understand if there is something, some of the function that you have placed. Yeah, you can stop and share again.
Okay.
Yes, when you click on play, are you able to see the other options of Zoom controls?
No, once I'm getting it full screen, I'm not able to control anything on my screen.
Okay, so you can do one thing. You can increase the zoom on this, and then you can continue. Yes, yeah. That way you can manage.
Is this thing okay right now?
Yes, it is visible.
Yeah. Yeah, let me open the chat box. So let us start from the previous slide in itself. So once we have established that there is an obvious link between water with nutrition and health, let us elaborate this diagram on such aspects. That, as we find that drinking or exposure of contaminated water leads to water and nutrition related disease, having poor and that is again a vicious cycle that gets established through poor nutritional availability and loss of nutrients, leading to several forms of diarrheal and other waterborne diseases. So let us be more elaborative that drinking, how contaminated water is responsible for water-related health problems like fluorosis, arsenicosis, gastrointestinal problem, cholera, and skin disorder. And you may find that renal stones are an obvious problem when there is a low consumption of body water. And this further leads to anemia, osteoporosis, and rickets due to malnourishment, and even chronic or acute diarrhea also leads to death of many children in our country. So now, what is the fluoride and malnutrition linkages? malnutrition linkages. This table elaborates what is the linkages between fluoride and malnutrition. You see that if there is fluorosis, there will be high dental and skeletal fluorosis. There will be destruction of mucosa in the intestine, resulting into iron deficiency. Then there will be thyroid imbalance. There will be calcium deficiency, and this calcium deficiency will further lead to fluorosis. Diarrhea. Next slide is diarrhea, anemia is are obvious reason of water quality issues existing in any community. Salinity. This table elaborates the salinity and health linkages. The next table reflects that water hardness and cardiovascular diseases, how it is impacting the health conditions. Coming to the next slide. So let us see what are some integrated approach that is existing in our country on management of water and health. Coming to integrated fluorosis management, safe drinking water is one of the major components of integrated fluorosis management. Iron deficiency, both health. Next, coming to integrated acidosis mitigation, safe drinking water and nutrition with focus on protein and antioxidants. Skin problems get specific focus on examination of acidosis symptoms. Early stage cancer detection in endemic areas and prevention on onset. Palliative treatment of skin and other disorders helping in rehabilitation of severely affected people. What is the 7-point diarrhea management plan are fluid replacement to prevent dehydration, zinc treatment, rotavirus and measles vaccination, promotion of early and exclusive breastfeeding and vitamin A supplementation, promotion of hand washing with soap, improved water supply quantity and quality, including treatment and safe storage of household water, and community-wide sanitation promotion. Next, coming to the next slide, what are the 5 points that we have to remember for water safety? As we have 5 fingers in our fist, so one finger represents one component which needs to be protected from. The first component being the we have to protect the source. Then the next component is we have to protect water from during transportation. And the third component that is relevant is we have to protect water at location of use. That is, when you are using at our household, the water should be protected from any contaminants. Then we have to monitor water regularly. That is the fourth finger or the fourth component of the water safety management. And the fifth one is the what we have to look for is that is there any contamination related history or background within a community. So these are the 5 major components that we have to always keep in mind while thinking of water safety planning. So there is a question for all of us: how do such integrated water health approaches get implemented in our country? If you have any idea, you can respond to the chat box, please. So one platform how water and water health management are being managed in our country is that the district water quality platforms. We find that PhD along with other converging departments like health departments, schools, and other institutions like Anganwadi centers, they are working in collaboration and convergence for active management of waterborne cases and water quality management. So the summary for the entire session is that water supply and health needs an integrated approach. Nutrition has strong linkages with many water quality problems, and some integrated approach has been implemented and showing promising results. So this was our first last slide of the session. So I request Kiran to
Thank you so much, Shashanji. Basically, you have covered really well on the need for an integrated approach for water supply and health, why there is a need. We had also presented on what is the integrated fluorescence. So contamination like fluoride, when it impacts the health, that we already came to know from Navanita ji in the first session and Rashida in the second session. So how we can address the situation, how we can manage with the nutrition, and there was a nutrition calendar presented by Shushavan ji in the session. So it was so much detail. Also, there is a five-finger concept that for water safety planning, how he has Shushavan ji has presented, how we can make things in a day in this session. We have also covered the district platform, how district platform is working to addressing the issue of water quality and health, how all the departments can come together and think about a solution, an integrated solution for water and health impacts. So this is what we have covered in this session. I request Shushanji to stop the screen share. Really thank you, Shushanji, for the presentation. And you can find the assessment link for this session in the chat box, and you can proceed to uh, start uh, uh, start completing the assessment for this session. So we'll wait for who is completing the first response. Then you can keep us posted in the chat box. You can write we're done with the assessment. You can also write what is your favorite question for this assessment and your score. The first response is full out of full. We have received two response. We'll wait for more response. We'll wait for at least 80 response here in this session for all the participants to complete the assessment. Then we'll move to the next part. In case of any difficulties while completing the assessment, you can let us know. You can write in the chat, in the WhatsApp group. You can write here in the chat box. We'll try to resolve. Thank you, Mutraji, for 4 out of 4 and completing the assessment. You can also write your favorite question in the chat box that which question do you like most in the assessment part. In case of link, assessment link, you can find in the WhatsApp group. You can complete the assessment there. No worries, Gagiji. We'll have more assessment in coming sessions, coming days, and we'll have an opportunity to become a water quality champion by active here. So as you can see here, 21 responses we have received till now, more than 20 responses. We'll thank you, Vijayalakshmi. We'll wait for some more response, then we'll move to the next part. Congratulations, Vijayalakshmi, for this score. Thank you, Narendra ji, for this update, and congratulations for the score. Thank you, Vijayalakshmi. Thank you everyone in this group who have really participated very well in the chat box. Initially, we found some difficulties with technical difficulties with Sushanji. They could not see the chat box, but we are consistently here and seeing all the responses from Naren. Thank you, Bharti. Thank you, Nitinji. Congratulations, both of you, for the score. Requesting all the participants to complete the assessment and then we'll move to the next part. The next session will be happening in the main room. So we'll wait for completing all the assessment by the participant and we'll move to the next. Thank you, Dr. Hitesh. Thank you, Kamal Marji. You have also completed attestation using code. Thank you for letting us know. Congratulations, Gurjeet. Congratulations for Vinaji. We'll wait for more response, then we'll move to the next part for the expert session that will be happening in the main room. Thank you. Then write here in the chat box about your favorite question you liked in this session. All the three sessions were really interesting today. I starting with Nabanita ji, then Rashida, and another with Susharan ji on health and water and health. And what is the integrated approach to address the impact of water and health? Thank you, Kantaji. Okay, Mr. Lakshmi has updated of that, also completed the attestation. Thank you so much. I hope you all the participants are familiar with the PD, and we can after assessment, completing the assessment year, we can complete the attestation. We'll wait for more response. You can type your favorite question in the chat box here for this assessment. I request all the participants to complete please make sure that you have completed the assessment before moving to the next part. Assessment is an important segment for all the session here, and is an important component of the overall water quality management course. We are close to our target. We'll wait for some more response, then we'll move to the main room and we'll continue the session with an expert. We'll wait for 10 more response, then we'll move to the next part of today's session. Really happy to see all the participants here completing the assessment. And all the participants are really active in the chat box. All the questions and all the information that you had shared with us. So thank you so much. We'll wait for some more response and then we'll move to the next part. Thank you all of you who have completed the assessment. Those who have not, I request you to kindly complete the assessment on time. We'll move to the next part of today's session. So thank you all of you for the participation in the breakout room. We'll move to the main room again and continue with the session with the expert advice. So I request all of you to kindly join the main room, leave this breakout room and join the main room of today's session.